Morning, everyone. My name is Ryan Haig, and I'm going to be presenting my physical activity from the fall of 2023 and a bit of a breakdown of what I had for this semester. Now, first, CDC guidelines are fairly manageable. You want to hit about 150 minutes a week of moderate physical activity, about 75 minutes of vigorous, do about two resistance training days per week. There are also some other guidelines depending on your age and your health status. You may want to engage in 2 days a week of stretching routines as well. And you may want to do 2 days of neuromuscular and gait training to really ensure that you're able to maintain that healthy life. And it is also recommended to split them. You can do moderate and vigorous activities in conjunction with each other, and we've seen several studies that show that vigorous has a little bit more enjoyment than moderate due to one, time efficiency. If you're strapped for time, then vigorous activity, depending on your health conditions, can do more with less time. If you're a heart condition patient or hypertension, you may not want to, or you may want to slowly build up to that point, but beginning with moderate would be more beneficial. For the impact of inactivity, it's important to note that sedentary life can lead to a flurry of different health conditions, COPD, CHD, hypertension, some types of cancer. You can be more susceptible to all of these having a sedentary life. And so some is better than nothing if you're just trying to really work on that moderate health or have some nice healthy lifestyle, then just moderate physical activity will help. Sedentary life can also affect depression, your quality of sleep, and a lot of unhealthy weight gain. And that weight gain can once again cause CHD, and you really want to avoid these things. Now, what I'm going to be going over is my moderate, vigorous, and my resistance training activity for this semester. So to begin, this is a graph of my moderate physical activity. Now, for that first week, I didn't have my dogs, and so I didn't really go on walks or anything like that. And I didn't really do much that week because I was just studying. So on that second week, once I got my dog back and I was out walking him, and him and I will do some sprint cycles, and we'll run around quite regularly. And so that's generally where I get the majority of my moderate physical activity. Also, walking around campus, I like to do that a lot, and I take only the stairs. So this is what I would consider a little bit lower of what my actual moderate physical activity would be each week. But for the sake of known accuracy, I left it at the baseline 45 minutes a day, which left me at about 325 minutes a week of moderate physical activity. Next is my vigorous physical activity. For this semester, I wanted to challenge myself. From the studies that I was seeing, I saw a lot of evidence to support vigorous activity and its benefits. So I wanted to increase that amount per week. Now, baseline, I didn't hit the exact amount that I would have liked. I was aiming for the 70 a week, but some complications arose. And so I was happy with the amount that I was able to hit with this. It was comforting to see the graph of it and the fact that in that fourth week, I really did a lot of HIIT training. Now, I should note that at the end, I didn't add it into this because honestly, I didn't think of it. I just added it into my regimen, but I started picking up tennis in weeks 14, 15, and 16. So the HIIT training for that, because I do a lot of against the wall training, it would have spiked quite dramatically. So it would have been nice to watch that spike. But and for my resistance training, I I like to lift, so this wasn't something that I was too worried about. I was hitting, I think on average about 350, 370 minutes a week for my resistance training. I do a fairly rigorous regimen. So, and I do switch it up every 8 weeks or so. So, as you can see, it does shift with how much I'm doing. And that's because I changed my regimen. Next is the percent of my activities. I don't do a lot of activities when it comes to my training. My dog walking, I've got tennis, hit, and resistance training on here. And as you can see, the majority comes from dog walking and my resistance training. Hit would have been increased by a few percent if I'd have added tennis back into the um, hit training as well. However, I wasn't sure of the time that I was out there, so I wanted to remain as accurate as possible with what I knew. So I will be enjoying to increase this a little bit more dramatically. I'd like to add a little bit more hit training, and I want to lower my resistance training just a little bit. But I am happy with my moderate physical activity. I think I did a good job with that. Now, in conclusion, how did I do? Now, based off of the CDC guidelines, I destroyed the numbers that I was supposed to be hitting. I would say that I am doing a little bit more resistance training than is necessary, but I am trying to gain weight currently, and I'm doing a little bit more volume with less strength. So that's why the amount of time that I take in the gym is usually about 45 minutes to 60 minutes, which is in the ballpark of what I was looking for. I am looking to increase my vigorous activity, though. I believe that's going to be important for me, especially in the long run for my overall health and my time restraints. The biggest thing that I saw out of this is that I don't have any prior health conditions aside from cancer, and my cancer was a different story. As we've gone over in class, was a bit of an outlier, and I've had no other health conditions prior to that, and my family doesn't have any history of any conditions. So I believe that based off of my physical activity and my family's history, I am in a great spot to be able to maintain a fairly healthy life. My biggest issue is nutrition, which I am looking forward to changing in this coming year, adding in new vegetables, new fruits, and cooking in the house a lot more with a lot less takeout. I believe the nutrition side is going to be the greatest benefit for me overall, because the physical activity I do have locked down pretty strongly. Finally, my bibliography. I did use primarily the CDC guidelines for this. And that is all. Thank you.